Dr. Salome Oboyi died on February 2nd, 2026. She was young, brilliant, dedicated. She died from Lassa fever. She contracted it while treating a patient who came in as an emergency. She did everything right, followed protocols, reported herself, got treatment. She died anyway. She's not the first. In 2025 alone, 98 people died from Lassa fever in Nigeria. 24 healthcare workers were infected. The case fatality rate, 18.3%. Almost 1 in 5 who get it die. 4 healthcare workers were infected in just the first 3 weeks of 2026. 3 doctors died at Federal Medical Center, Jalingo in 2024. Dr. Mohammed died in 2020, leaving behind a widow and 2 children who are now 6 and 3 and still don't know their father is dead. This is the price we pay for healing in sub-Saharan Africa. Listen, I need you to understand something. We didn't stumble into medicine. We were the brightest in our classes, top scorers, the chosen ones. We entered medical school with stars in our eyes, ready to save the world. 6 years later, we graduated with that MBBS certificate, and for one brief moment, we thought we'd made it. We had no idea the real trial was just beginning. House job is where they break you. You report at 6:30 a.m. for pre-rounds, consultant rounds at 8 a.m. if they show up on time, then documentation, clerking new patients, running investigations, updating charts, chasing lab results, drawing blood yourself because the phlebotomist who's literally paid to do that expects you to do their job. Then there's the call. Every few days, you take call. You work your full day shift from 7 a.m. to 5 p.m. Then you start the call at 4 p.m. and work through the night until 8 a.m. the next day. Then you attend post-call review at 8 a.m., yes, immediately after your sleepless night, and you continue with rounds, documentation, secretariat duties. 30+ hours continuous. Some departments have weekend calls, 48 continuous hours from Saturday morning to Monday morning. During that call, you might be the only doctor covering both the ward and the emergency room, and when you dare to complain, we did it too. You are not the first. This is how it has always been done. So the cycle continues. Our elders suffered, so we must suffer. Tradition demands it. But the long hours aren't even the most dangerous part. It's the diseases we face with inadequate protection. Lassa fever season runs December to March in Nigeria. Patients come in with fever, headache, vomiting. Could be malaria, could be typhoid, could be Lassa. We have to find out. We examine them, draw their blood, insert IV lines, intubate if necessary, with whatever personal protective equipment is available, which is often inadequate. Dr. Divine Jadze remembers the day, February 17, 2024. Emergency call. He rushed over. In his hurry, he forgot to put on surgical gloves. He was lucky that time, but 3 of his colleagues at the same hospital, they died. He said something that haunts me. We may have up to 12 suspected Lassa fever cases in a day during peak period. Different doctors see the patients at intervals, so the PPE is never enough. Never enough. That's the story of Nigerian healthcare. Equipment is never enough, staff is never enough, support is never enough, and so doctors die. You want to talk about irony? We are custodians of health, yet Nigerian doctors have a lifespan lower than that of the average policeman. We preach work-life balance while working 300+ hours per month. We diagnose burnout in others while suffering the highest rates ourselves. We tell patients to seek early treatment while working until we collapse. We're called heroes, but when we die in the line of duty, our families get little to no compensation, and the system just moves on. So we leave, in droves, through USMLE for America, through PLAB for the UK, through exams for Canada, Australia, New Zealand. Nigeria spends millions training us, and we leave. Brain drain, they call it. Betrayal, some say. But can you blame us? Can you blame a doctor who watched colleagues die from Lassa fever for wanting adequate PPE? Can you blame a house officer who worked 48 hours straight for an 8-hour shift? Can you blame someone earning less than the hospital janitor for seeking fair pay? Can you blame a young doctor who wants to start a family for not wanting to die before 40? We are not abandoning our country abandoned us first. The solution isn't complicated. Implement shift systems, no more 30-hour calls, provide adequate PPE as standard, not luxury, pay us fairly for the years of training and risks taken, support doctors who fall ill in the line of duty with comprehensive insurance, treatment access, disability benefits, death benefits. Staff hospitals adequately so no single doctor is running everywhere with no backup. Invest in basic infrastructure, functional labs, reliable electricity, clean water, and respect the profession. Stop treating us as disposable. Stop the "we suffered so you must suffer" mentality. Break the cycle. These aren't radical demands. These are basic human rights for professionals who sacrifice everything to keep others alive. To the policymakers, your silence costs lives. The doctors you trained are leaving because you made the alternative unbearable. To hospital administrators, the system is broken and you know it. Stop defending it. Start advocating for your staff. To senior doctors, you have power. Lose it. Don't perpetuate suffering because you endured it. Be the generation that says enough. To my fellow young doctors, hold on, speak up, demand better, and if the system refuses to change, don't let guilt trap you. Your life matters too. To the families of fallen doctors, we see you, we grieve with you. We will not let their deaths be in vain. This is not a cry for sympathy. This is a demand for justice. This is not a complaint. This is a call to action. The price of healing should not be our lives.